Hello everyone, my name is James Phillips. Today I will be presenting a case of intravitreal injection of autologous stem cells to potentially treat age-related macular degeneration, or in short, AMD. Researchers developed this trial to potentially cure AMD in elderly patients and to eliminate the possibility of AMD from causing blindness. Its process was solely based on previous success of other stem cell research happening at the same time. AMD is a neurodegenerative disease that impacts the macular region located in the central region of the retina. In December 2016, just 4 months before this trial was made available, there was no known cure for the progressive blinding disease that affected mainly women, but men also. AMD affects the individual's basic components of sight, such as reading or recognizing faces. The methodology for the stem cell procedure was simple in its process. Step 1 was to inject the adipose fat rich areas to prepare the sample for retrieval. As you see in the images, the highlighted orange places are places where you can retrieve adipose tissue. Step 2 was to draw out the adipose tissue solution that had been injected in step 1 15 to 20 minutes later to separate stem cells from the adipose tissue. Additional steps were happening simultaneously while steps 1 and 2 were being performed. 35 mLs of whole blood was drawn to establish a plasma product. This would be the foundation for the injection. Liposuction aspirate was processed to create a pellet of stromal vascular cells, which would be used in the intravitreal injections. The pellet cells were resuspended into the plasma product, which was then used to immediately inject into both eyes of all three patients. As you see from the images, patients suffered from three main symptoms that presented themselves quickly after being injected with the autologous stem cells. Anterior subluxation, which is when the lens is dislocated from the pupil but remains in the general location. Macular thickening, which affects how the eye can create detail in images and central vision. Lastly, hemorrhaging, which is when blood vessels erupt and oozes blood in locations that it is not supposed to be located. As you can see from image 3, Charlie, the blood was poured into the pupil wall. The statistical significance of the study shows, reading the table left to right, a substantial increase of vision impairment or loss of eyesight altogether. Vision measurements start to move in the wrong direction or worsen to the point of not being able to evaluate by the end of the trial. Patient 1 suffered from anterior subluxation of the lens in both eyes, but was more prominent in the left eye. Macular thickening, as you've seen in the image before, were noted. Retinal detachment and adhesions in the left eye, while hemorrhages in both eyes were documented. Patient 2 and 3 experienced several of the same issues as patient 1. In summary of the trial, 3 women underwent a fairly new method of a clinical case to potentially cure them of their AMD. However, with no proven method or cure at the time, adverse events to the patients involved started to increase rapidly. Unfortunately, the 3 women in this scenario suffered from the researchers' lack of proper protocol. Here you will see a quote. The fact that stem cell therapy is rather a new domain makes it subject to scientific, ethical, and legal controversies that are yet to be regulated. The future of stem cell therapy will begin to establish more regulatory processes to understand the overall safety of the procedure of stem cell therapy. The importance of this and the importance of preclinical trial moving forward, especially with stem cell research, is the future cure for a projected 22 million individuals that will be diagnosed with age-related macular degeneration by 2050. After the present case had such a devastating result, many other cases started to arise with intravitreal injections of stem cells, causing blindness started happening all over the world. It was so bad it got the FDA's attention that made them issue a warning to cease all operations. According to multiple reports around the world, stem cell injections to treat AMD were increasingly rapidly and producing the same catastrophic results. The mystery in this case is how easy it was for researchers to propaganda the trial without any preclinical trials or proven methodology that backed up their claims. Simply stating that the other stem cell injection therapy had positive outcomes, to me personally, is not enough justification to perform unproven methods. One part outlined has me concerned about the integrity of research altogether, and that is the blatant disregard for the patient's safety regarding testing just one eye versus both. At least in this scenario, if results showed like in this trial for the one eye, the other eye could be saved from a speedy regression. One of the researchers even stated that we would have injected one eye and monitored results, but we didn't. It's also concerning that individuals had to pay out of pocket $5,000 for a study that had no positive feedback or supported claims to benefit or increase the current health and welfare of the patient. This concludes my presentation. I hope everyone has a clear understanding of how AMD affects eyesight of the elderly and how important it is to create an effective and efficient protocol to find a proven methodology, and B, hopefully finding a positive cure or a possible cure for the projected 22 million that will be affected by 2050.